The comments will come up under, oh, I see private chat is just with you comments.
If you go to the top on the top right, you can see the comments as well. Yeah.
Cool.
So yeah. Okay. So I am so excited. We're going to give it a couple minutes for people to start popping on. We are streaming live through Facebook, through our YouTube channel, and through Twitter tonight. So we're on multiple platforms. So yeah, this is kind of fun. So yeah, it takes a couple minutes for the algorithms to kick in and people to hop on, and they send reminders. So yeah, we're excited, and people may even be watching that don't comment. So we have a lot of stuff that we can look at. So anyway,
Awesome.
So
yeah, it's very exciting.
It is kind of fun. I'm learning as I go.
Facebook, YouTube, Twitter, Instagram.
I don't have Instagram on here right now. I probably could in the future, but I didn't schedule it through IG. Cool. So yeah, we're just doing these three main platforms. Awesome. Thank you, Dr. Jeff, for being with us tonight. This is exciting. I love learning from smart people so I can get smarter. And you can always take something away from a conversation or a chat and a podcast or whatever, even if it's one or two little nuggets, that it was just like meant for me to hear or someone to hear. That's my goal, is just to help empower people to make better decisions and have a little more knowledge. And people who are especially looking outside of the box for alternative healing and solutions and things like that. So share with us just briefly how you got into doing what you're doing.
My goodness. I guess we could answer that. I can answer that in one word, which is observation. Observing animals and myself. A walking experiment, and unfortunately, I've been experimenting with myself for over 40 years.
Wow.
So I started as a research scientist looking at the individuality of cells. And from basic science and molecular biology research, I went to vet school and was going to go into the PhD program, and was already in the PhD program, but decided instead to go to Hawaii. And I almost gave up being a veterinarian at that point.
Yeah.
But I came back and ended up being a clinical vet, and through observation of my patients, I arrived at holistic care, which I never even heard of. And eventually, through holistic care, energetic medicine, which isn't a routine part of holistic care, because it doesn't really integrate into the model the way most holistic things like diet and vaccines and toxin, but energy does as well. And that's kind of what we're teaching and what we're doing now, which is online, and it's a platform to do just what you said, empower parents to make better decisions using what we call holistic medical decision making.
Yeah. And I think that's so critical, because you probably see this every day, people reaching out to you that have tried the conventional route that are just not getting anywhere, or they're seeing their pets decline and they're desperate. They're like, I'll try anything. I'll do anything. Just help me help my pet. And I know that you work with cats and dogs, and do you also work with other small animals as well?
We'll work with anything with life force.
Okay.
So, yes. Mainly dogs and cats.
Okay, cool. That's awesome.
We all share, that's why there's one strategy for every animal.
Yeah. And I love that energy medicine, like a lot that you do, is not a one size fits all. It is very specific to that particular pet, because that's where I think the allopathic road goes wrong, because we're all individuals. Our pets are individuals. So you can't put everything in a box and label it X, this is A, because that pet may not be an A. It might be a Z. It might be, our bodies are so different. and our environments are so different. So you can't put everything in, the allopathic conventional model. It just doesn't work. And that's why people aren't getting results.
I don't know if you want me to open that Pandora's box with me, but that is my bailiwick in that I'm a science nerd at heart, and science has finally described exactly what you're saying. Science has caught up with us, or is catching up with us. Every cell, every individual is a snowflake. Every body is different and looks different and needs to be treated different. And there's a way to do that, a scientific way to do that.
Yeah, I totally agree. So let's jump in, because I mean, you probably see this every day in your practice, but GI issues are probably some of the most common issues, whether they be mild or very, very extreme. So talk a little bit about what you see most often on that spectrum, and it can be the broad spectrum of those kind of issues.
Okay, that's a great question and a great place to start. Biggest category that I see are dietary problems, usually manifesting as diarrhea, bloating, vomiting, upset the stomach, just ADR, ain't doing right, not feeling right, that kind of thing. But switching the diet to a fresh food diet often alleviates that totally. So we'll go beyond that, because we'll assume that most of the people watching this have already gone to a fresh food and hopefully even a raw diet.
I think a lot of people get stuck on the veterinary diet because they go to the vet for these issues, and the vets say, you need to go on this special dry food that's a prescription, which we all know there's no medicine in it. Prescription is just a marketing term. So if we could get more people to switch to the fresh diets, you would probably see a huge shift in eliminating GI issues.
And Pam, you said something that really strikes a chord, and that is dry food, which is not appropriate for cats, and that's now conventionally accepted wisdom by specialists in cats.
Yeah.
But unfortunately is not filtered down to the pet food companies yet.
Right.
And the worst is the dry food for bladder conditions, because bladder conditions are almost always, I know we're not talking about them tonight, but are almost always related to a little bit of dehydration on the individual level. And the dry to that. But back to GI, the number one issue from diet or vaccines or pretty much any external stressor is diarrhea.
Right.
And
go ahead.
I air quoted diarrhea because the word diarrhea doesn't really tell us what the body is doing. It just tells us that there's an abnormality, but it would be great to know what the details are.
Yeah, and so there is the upper GI and there's lower GI, which is small intestine versus large intestine. So can you describe like the difference in those symptoms of the diarrhea if something is upper GI versus lower?
Sure. It's mainly difference in volume, frequency, mucus, and straining. Kitties, unlike dogs, more frequently have like a stress colitis, which manifests as frequency straining, maybe not passing a lot, mucus and or blood, which freaks everyone out. Yeah, but needlessly usually. Versus large bowel, small bowel or the small intestinal diarrheas, which tend to be larger quantity, sometimes smelly, weight loss, and they lose more fluids that way. So it could be more serious.
So if it's lower, it's really, you see more of the mucus issues. And if it's upper, it's not so much that, right?
Yeah, and I don't see that many colitis issues, lower GI issues
Good.
in case compared to upper.
Yeah.
I think the majority of them actually are alleviated by diet and probiotics.
So do you think a lot of those are obviously a microbiome imbalance, but do you think the imbalance is due to environmental toxin? And some of that is food related? Do you think it's vaccine related? Do you think it's all of the above?
all the above. I'm going to go back to the one model, and that is the dynamic equilibrium, which is balance or homeostasis in the body. All the things that you mentioned disturb that balance.
Yeah, absolutely.
How much an individual is disturbed is based on their susceptibility to that, to being disturbed. So two cats can get the exact same exposures, one gets sick and one doesn't.
True. So do you see, like, for example, okay, I know you see probably a lot of stuff that has to do with antibiotic use, overuse of antibiotics that totally destroy the gut flora. And like the flea and tick meds and the topicals that totally destroy the gut flora. But those can be serious. I mean, people don't really understand how serious those long-term consequences can be from using those things.
Exactly. And really a couple ways. I mean, long-term in that the individual exposures like that do add up. And that's definitely frequently, if not always, part of cancer and other serious inflammatory diseases. And inflammation, by the way, is just the body doing its job. I mean, we heal, kitties live by inflammation. What we don't want is chronic inflammation.
Right, right.
And those things can induce both. And the best example is kitty that gets diarrhea after a vaccine. Nothing wrong with vaccines, but vaccines are injecting toxins.
Right.
So I just kind of look at vaccines in the same category as toxins.
Yeah.
Would you want to be exposed to mercury, aluminum, or whatever is in the vaccine? I don't think I'd want my dog and kitties to be.
Right, right. Because they can certainly, that kind of stuff has serious long-term consequences that people don't realize. Yeah.
But I do want to go back before you move on to the microbiome and why that's so important, and that is the balance of the microbiome of the bacteria in the gut are directly related to the balance of the individual.
Yeah.
You can't be balanced overall if the microbiome's imbalanced, which is where using different probiotics, different strains, come in. The less frequently used one, there's one called Mitomax.
Okay.
Which is a unique strain that's in one or two others. But if a kid has diarrhea and you've already done the diet and you're rotating probiotics and some work a little bit, but not, try that one or try the bacteria that's in it.
What about S. boulardii? Saccharomyces S. boulardii. Have you used that at all for treating imbalance? Dr. Suter says bugs to the rescue. Yes, absolutely. Good bugs. Good bugs to the rescue. Yeah.
So yeah, wide variety, but it all depends on the individual. Some respond to one and not another.
Right. So you mentioned something very important that most people don't know is to rotate their probiotics. Why don't you explain to people, our listeners and viewers, why that is so important?
Well, that's one way to get balance, just like rotating foods. The one of the second hallmark of a good diet, it's a fresh diet, it's varied, and you don't give any ingredient in large amounts. It's all moderation.
Yeah.
So you vary the probiotics like you would vary the food. If it's working and your kitty has chronic diarrhea and you stop using it and it comes back and you want to go back on it, there's no problem with that. But, if I wouldn't say probiotics aren't solving the problem until having done like 3 or 4 different ones.
Yeah. And then do you do anything like to seal the leaky gut that may be also involved?
What a great question. And the answer is yes and no.
Okay.
Because I don't do, and medicine of any kind doesn't do anything.
Right.
Kill leaky guts. The body does. And the one thing we know for sure is the body is designed to heal. Kitties heal. In fact, kitties are amazing healers, much better than people and dogs and many other species. And we can get back to why that might be later on if you like. But yeah, there are products that are designed for healing the tight junctions. But I realized after I mentioned the probiotic that you may or may not want me to mention products in particular. So
you can certainly do that. Why not? I'm all for giving people tools. So yeah, if you have favorite products, by all means, share.
Awesome.
Yeah, absolutely.
But by far the best thing, the most important thing for healing the tight junctions and leaky gut is going back to energy. Getting, and there are energy building strategies that kitty parents can use.
Talk about this. That sounds really interesting.
Well, my favorite one, the most common one, is feeding.
Okay.
There's an energy hierarchy in food, with raw food having the highest amount of vitality or energy, and the lowest is dry food.
Right.
And canned food is better than dry, freeze-dried, air-dried, fresh, cooked, and then raw.
Raw, correct. And that's because you don't kill off all the living enzymes that are in the fresh foods. Just like the same reason we eat fresh food and not canned foods and processed foods out of a bag and a box all day long. You want to get the benefit of those living enzymes in our body so that they can actually work. So apart from that, fresh food, what would be like another strategy that you have?
For energy building, the next one I would probably say that's easiest to use is promoting purring and playing.
Okay.
There's lots of good evidence that the purring of a cat is like I can't do it. Ujjayi breathing in yoga. Restricted breathing and slowing of the breath and activating the parasympathetic nervous system can do that. Not only for your kitty, but a great healing strategy, especially if you're stressed or anxious or depressed, is to have your kitty on your chest purring away. And that purring activates your own vagus nerve and helps relax you.
Oh, that's cool. That's cool. Yeah, and that's probably one of those things that we all intuitively know, but we just never put into words because everybody loves a purring cat on your chest or your tummy. There's just something very, very soothing and wonderful about those moments. We're willing to sit there when we have to pee for 30 minutes, not because we don't want to disturb the cat,
Right.
It's like, I'll just hold it a little bit longer. You're too darn cute. I'm not going to move you, So absolutely. So what other strategies can you share about energy building? And
I think the next easiest to use, actually the next two are related to the purring because the next one's happiness. And we know in people, this is not research verified yet in animals, but that's something that we're working on. That the emotional state of being happy or in kitties, getting the zoomies or purring or you can just tell when they're happy.
Oh yeah, yeah.
That raises up the mitochondrial function and the optimizes the body and the ability to heal.
Oh, that's cool. And then obviously play sessions would fall into that because that makes them happy and excited and energetic and good exercise and stimulating their mind as well as their body. So you have a Bengal.
I have two diametrically opposed kitties. I've got Yoda, the older Rex cat that's like 5 pounds,
Yeah.
and Aviva, who's this big monster 1-year-old. I mean, who likes to beat up Tiggy, but Tiggy just says, "No, I don't think so," and goes like that, and she goes the other way. Aviva.
Yeah, she's got a lot of energy. Most definitely.
Yeah, and that's a really good point. I'm so glad that you said that because it's that energy that we have when we're young, when kitties are young. That's the energy that we don't have when we get old and pass away, and that's the difference between life and death. And that's why it's so important to keep your tank filled.
Yes,
And
absolutely.
do everything for your kitty that will keep his or her tank filled.
Yeah. So, are there any other tips you can think of, like in terms of specifics on diarrhea? Maybe some, I don't know, your favorite homeopathy? Is that something that you would recommend, like maybe consider trying, or based on symptoms and things like that? I love talking about homeopathy, so I'm gonna throw it in there.
I'll only talk about that if you let me talk about what symptoms are and what we're
Absolutely.
doing,
Yes.
because you don't use homeopathy like you use drugs or any other supplement.
Right.
We equate holistic and homeopathic. No, totally different.
Yeah.
Holistic is just looking at the bigger picture and, it could be almost anything. Homeopathy is especially designed way of working with nature. I mean, it's basically the way that nature heals. That's actually what we're doing now with One Health Medicine and a more sustainable pet care is by using energy and homeopathy, because energy and the energetic imbalances in the body is it's a part of medicine, but it's a little bitty part.
Right.
Information flow and subtle energies, and we know about them, but we haven't connected to the fact that they're the underlying cause for all symptoms.
Exactly.
But that's
Exactly.
coming soon. I mean, I'm just so jazzed to be alive at the scientific time, in the world.
No, it's
But
true.
so yeah, there are tons of other energy techniques, as you know, happiness being the one, and being one of the big ones that you can easily do, and all of the energy building techniques can improve diarrheas.
Yeah.
For sure. But you didn't talk about the most common GI thing that kitties get.
Vomiting?
Vomiting.
Vomiting. That I see that more than anything in clients, and yeah, it can be from minor stuff like cats who just go out and want to eat some grass, make themselves throw up. It can be regurgitation right after they eat. It can be hours later you find a pile of throw up somewhere from the previous meal 12 hours ago or whatever it was. So let's talk about vomiting, because there's a lot of different scenarios and there's different symptoms. So yeah, share about that, because that is very common for people dealing with pets, cats.
Well, I'm gonna need to push on this one and go back and talk a little more about symptoms, and in
Yes.
this case, symptoms vomiting and what they really mean. And well, then we can decide
Yeah,
by getting all the information as far as what to do.
absolutely.
And I'd say that if you've done all of your energy building strategies, that they're on a fresh food diet and they're still vomiting, that there's evidence from the symptom of vomiting, whatever the details are, that things are still imbalanced. And that is actually what I want to mention, is that we don't really know as veterinarians what a healthy cat, a well-balanced cat looks like. Cats are not meant to occasionally vomit hairballs.
Correct.
You know, occasionally once or twice a year maybe. But no, the GI tract, when it's well balanced and strong, is either digest and pass or totally digest the hair, but it doesn't accumulate for days, weeks.
Yep.
So yeah, that's where we start with the energy building. But a lot of vomiting, as you know, is scarf and barf. Maybe the most common actually vomiting I see is kitties that eat quickly and then barf within usually a few seconds, but a few minutes. And the happiness, breathing, and scarf and barf tool that kitty parents can use that we just recently started for Viva and Tiki is the Mind Pet Platter.
Talk about that. I don't.
It's a wonderfully sustainable tool, meaning that it's made by in a sustainable way, made in the U.S. It's just a platter, just like you serve food on for yourself, but it's got divots in it.
Yes, the little rivets.
And a ridge around it, and you just fill it with the raw or canned food, and
it slows their eating down.
Slows eating down. They're mindful. They sniff and build their energy. It just makes happier cats. I mean, my 14-year-old kitty is like, now she's just all energized at mealtime.
Right. What about? Yeah, go ahead.
I was going to say, as are Aviva, the young cat, and Archie. They all. It's like.
So if it's not a scarf and barf type of situation, well, let's talk about why do you think cats scarf and barf? Is it hoarding resources? Is it anxiety between cats? Are they fed too close together? Should we separate them apart so they don't feel like they're trying to eat their food real fast so the other cats won't take it? Or let's talk a little bit about that and what you see.
I think that you hit a couple of the biggies, and yeah, I'm not a big fan of feeding cats or having cats even too close together, because they need to be able to find their own space. And actually, being clustered like that, and especially eating like that, can increase stress and stress-related diseases, because emotional stress in the kitty can manifest in any way, and the most common way is, maybe going off the food, or Pandora syndrome. Are you familiar with?
No, share with us that.
That is the what used to be called FUS or FLUTD or FIC or any pick your acronym. But Pandora, like you've opened Pandora's box of of a stressor activating the body's blood and urine frequency, UTI symptoms. And it's rarely an infection, guys, needing antis to work against the body. But unfortunately, antibiotics are frequently prescribed for cats with UTI symptoms.
It's true. Yeah, one of the best things I ever learned was how to use homeopathy for UTI symptoms. So much better. So
And
much better.
and how do you decide what remedy to give?
In the traditional world, you would just look at their symptoms and behavior, but it's kind of hard with cats. Just I end up using a lot of muscle testing and asking the body a lot of questions and matching the remedy to the energy. That's how I've successfully been able to treat that, because it's not like they're going to tell you it burns when I pee, you know, or I just feel like I can't hold it, or whatever the symptom is that matches those remedies. That's typically what because there's a lot of different remedies, even for simple vomiting stuff. I mean, you just never know. You just have to go through your remedies and look at um, the data, not the data. What's the word?
Proving
The proving. Yeah.
Symptoms of the remedy, and
yeah, and see what those look like.
Because for someone like me that doesn't do, the kind of AK work or energy work that you're describing, or actually like the majority of people, the beauty of homeopathy is its science. At its core, this is up there for a reason. This is the only monument in Washington, D.C. for an MD, and that's Samuel Hahnemann, who is the discoverer, founder of homeopathy.
Yeah, it's pretty special. Very special. So go back to the vomiting. What about cats who don't do the scarf and barf, but like they may throw up hours later, or you find the pile of throw up the next morning and you don't know when it happened, but they may see, and then they don't want to eat, and they're just they have that low energy and things like that. So that's like a whole nother part of the spectrum of the vomiting side.
Exactly. And, it's really the details that tell you what to do. And the same as the answer to Michelle's question about IBD, diarrhea, or any other symptom. It has to be the details, not the name of the disease, not the general name of the symptom. But are we talking about vomiting hours from food? Are we talking about vomiting with food? Is it clear? Is it bloody? Is there blood clots? Does it smell? Is it associated? And all those things are clues to various homeopathic medicines, which we have found out by the provings. And no, you're right, sensations are not part of veterinary homeopathy. Sensations and dreams are the two really important parts of homeopathy for people that we can't use for pre-verbal kids or cats.
Yeah. And another symptom with vomiting is if there's bile, like if there's a lot of yellow, if there's no food, but it's all bile, and how that ties to a lot of pancreas issues. And, like you said, if there's blood, if there's blood clots, it's very important, like you said, to look at the whole picture and not try to label it what the vet calls things, because that's just allopathic medicine trying to put a label on something that, again, let's put it all in the same box when it may be totally different, or it may be a little broader than just that picture. So what would you recommend in those kind of those cases?
And I'll have to give you my stock answer, which is the answer to every one of these questions. And every question in veterinary medicine, and that is, it depends on the context. So I know, my personal mainstay after we do, or while we do the energy building techniques, and how you decide it's based on the severity of the symptom, which you can easily discern at home by BEAM.
Yes.
I think we've talked about BEAM A beam is the system that you can use to interpret, how severe any symptom is, how deeply it's affecting the vitality, the balance of the individual, and it stands for behavior, energy, appetite, and mood. So if they're vomiting, but their beam is fine, different interpretation than, a
Yes.
cat that maybe vomits once or twice, but has a decreased energy and they're off by themselves. And then
Yeah. Mm-hmm.
you need to look at the full context to decide what to do about vomiting or IBD or anything. And the one thing we didn't talk about, which I don't know how much time we have, but I wanted to bring up, and that is pancreatitis and triaditis that unify pancreatitis and IBD and something else with the gallbladder.
Yeah, go ahead.
And well, Justin, it's a real common issue in cats, common diagnosis if you wanted a diagnosis, and a lot of kitties that just don't want to eat ADR, which stands for ain't doing right, chronic intermittent vomiting, IBD, all that. They've got chronic pancreatitis going on, which manifests way differently in kitties than it does, pancreatitis than it does in dogs. So,
yeah, because some cats, and is this your experience? Like when you're looking at blood work for a cat, is always their pancreatic enzymes going to be elevated? Because I don't see that. So they could have pancreas issues, but their blood work may not really show that it's a pancreas issue. But that doesn't mean that their pancreas is out of balance energetically. Something is off there.
And that's the beauty. One of the beauties of energy medicine is that when the energy is imbalanced, there are no other signs. The vet or the doctor may say, come back in a month or 2 months, and we'll repeat the test. And hopefully by then the underlying problem got worse and we'll be able to diagnose it. But based on the symptoms that occur early on, we can treat them right away.
Yeah. So what would be your first step? Let's say you suspect that there is a pancreas issue. Would your first step be change the diet, change the food, change the protein? Like, let's get him off what he's been eating that he's throwing up all the time. Or what would it be? What do you recommend?
Well, before we even talk about that, I want to go to what you just said about the pancreatitis and without elevated pancreatic enzymes. The opposite is much, much more common, and that is abnormal elevated enzymes, but there really is no pancreatitis per se. And there's a specific test called a specific pancreas test that your vet can send to the lab. I mean, they can run tests in-house, but they're not as accurate as a lab test. And if that's normal, and these screening tests, because I would consider the regular panel of amylase and lipase and what you get on just be screening tests, but frequently you'll see, as you said, normal or abnormal, and it may or may not correlate with what's going on in the pancreas.
Right.
So the answer to your question is it depends on the context. If they're acutely vomiting, the number one diagnostic and therapeutic step is stop all food and water. NPO, no, nothing per us.
For like what, a day for a cat, maybe?
Usually anywhere from a couple hours to a day, yeah.
Okay.
You don't want to go much further because one thing we're not talking about today is susceptibility. And cats are not equally susceptible to liver disease or hepatic lipidosis, which is secondary to fasting. Some cats, like my own cat, can go a week without eating and no sign of liver disease.
Right.
Whereas others go for a couple days and they have signs. And that's based on their sensitivity, their susceptibility of getting liver disease.
Correct. Correct. What about in cases of pancreatitis? Do you recommend people use digestive enzymes to help kind of support the pancreas? And
Awesome, awesome, awesome. Yep, yep. But whether we have to switch diet and stay
Mhm,
switched to a low-fat diet or use enzymes or any supplement,
mhm,
what we're doing is we're helping the body along. We're giving a little crutch. We're supporting the body,
mhm.
but not curing the underlying disease. So supplements are really just a natural way of doing drugs. It's the same effect. Covering up the symptom instead of getting at the underlying energetic imbalance.
Okay. So how would you determine what to do? Just like give us an example of a case that you have worked as an example of bringing that to a cure, figuring out, any thoughts?
Uh, Tons, but that's kind of the answer, unfortunately, is again, it depends on the
Given the
context what I
context.
do. Yeah.
Yeah. Hmm.
It'll be based on the symptoms of the
Hmm.
individual. It'll be based on lifestyle, the full context.
Yeah.
Um, but especially on the energy level, the beam, the other
Hmm.
symptoms, the history,
Yeah.
other lab abnormalities. Is there an endoscopic biopsy showing IBD or cortical lymphoma? Because IBD can look just
Mask.
like lymphoma in the
Yeah.
kidney. Because allergy is an immune imbalance,
Hmm.
is immune imbalance. At one end of the spectrum is allergies and IBD and other inflammatory diseases as they progress can look just like and become cancer.
That's true. So it's good to try to get to the root cause. Now, if you have, let's say, a cat that just had an indiscretionary ate something or whatever, and a little pancreas, a little digestive enzymes change the food, and then they're totally fine and go along their merry way. That's great. That's ideal.
It
But
is.
if you don't see that and you dive into some of the more diagnostics to try to figure out, is there an upper GI issue? Is there, um, do we have lymphatic issues going on? Is the lymph nodes involved? Is there, are B vitamins being absorbed or not being, how the folate, the cobalamin, and all of that, what's the picture look like? That could be turning into a totally different issue.
Exactly. And you just described it, Liam. External and internal symptoms.
Oh,
So the lymph nodes, the behavior, the everything that you can see in an animal are the external symptoms. And
mhm.
then, if I, for example, don't see, or if you more commonly don't see where you can fine tune lifestyle and get further diagnostic tests and find that things are abnormal on the diagnostic tests.
Mhm.
That's when you have to get a little more aggressive with the energy building techniques, and you may want to support via diet, blend diet, or
Mhm.
enzymes. But while you support, you need to be, or you want to be working on curing the underlying disease, because you'll know it's cured when you're able to stop supporting the body.
Yeah. Yeah.
That's always the goal. Is nature gave us all that we need. Work with nature, follow nature. The solution to sustainability is in nature, and indigenous people that live off the land, that take care of themselves by herbal, and they're working and they're doing what people are designed to be doing, or kitties are designed to be doing. That's the kind of healthcare that we're moving to, and that brings us back to individuality and the fact that what you described at the beginning, as far as knowing what every individual kidney needs. In people, have the goal of personalized medicine. We talk
Mm-hmm.
about personalized medicine in veterinary medicine still a little bit, but in people it's now more precision medicine, using therapies as a tool. Like, I'm a carpenter with a hammer and screwdriver, and I'm trying to decide which to use.
Right.
Meaning it's not truly individualized. When the genome was discovered and described, we thought that was going to be the answer, but it wasn't. The answer is all the stuff that you're talking about.
Mm-hmm. Yeah, it is very individualized. Yeah. And that's why I think like some pet parents hesitate to take their cat to the vet all the time because they think they're just going to be put on this prescription food diet and they're just going to run all these expensive tests, but they just feel like they're nickel and dime, but they don't get anywhere with that. So it's very frustrating, and they're spending a lot of money. They want answers. So it's very hard. Do you have any recommendations for our viewers and people that are kind of in that boat?
Oh my goodness, I'm not sure I'm allowed to or should say, but of course I do, and that's spend $50 a month at Holistic Actions, where you'll learn all of these things. You'll get, unlimited support, including weekly webinars and one-on-one calls to decide what to do, and the ability to write on the forum. But that still has to be combined with your vet exam and diagnostic tests done by your vet. And who is the ultimate decider of what to do? You are the vet parent. So yeah, definitely go to the vet. And that's one of my top recommendations is go for an exam. Any indicated diagnostic tests. And a lot of times pet parents ask for a specific test based on the kitty's, symptoms and find out what's going on internally.
So are there specific tests that you would recommend for GI issues? And can you let us know what those are that maybe pet parents should be asking for?
The easier thing is maybe just ask for a GI panel.
A GI
there
panel.
there are
Okay.
panels. Texas A&M was like the original and still doing amazing research in pancreatitis and IBD and B12 and pancreatitis, everything. So,
Yeah.
but now lots of commercial labs are running, tests like the pancreatitis test or the trypsin-like immunoreactivity test, which, is a test for the pancreas's ability to digest, because chronic inflammation, as we discussed, is something you don't want, and chronic inflammation in the pancreas can end up the kitty with a pancreas that doesn't make enzymes real well.
Right.
That could be tested in the lab, and now they're even doing tests for the microbiome.
That's very cool. Do you mean like the fecal test?
There's a fecal test, there's the blood, there's all kinds of stuff available.
Very interesting.
Experimental stuff, breath stuff, oral stuff. I mean, it's amazing.
Wow.
Everything that we've talked about that you're teaching about is being verified in science. Just some things are going to take a long time, like the energy stuff that actually Erwin Schrödinger wrote about when they were developing quantum physics. He's a Nobel Prize winning physicist and friend of Einstein. They knew all this stuff. They knew E equals mc squared.
Yeah, I love quantum. I think it's fascinating. It's kind of the world I live in.
Then you may want to look at a book called Quantum Doctor by Amit Kaswani.
Okay, I'm going to write that down.
Quantum activist.
Oh, cool. Quantum Doctor. Okay. That's the name of the book? Quantum Doctor?
That is, yep. And this is what we've been talking about the whole time. I don't know.
Okay, Anatomy of an Illness, because I can put this in the notes of the show. Anatomy of an Illness. Okay.
And that's just the book by a journalist named Norman Cousins, who had an incurable, painful disease in the 60s. And I think the book first came out in the early 70s. P.S. his method, which was based on laughter and candid camera reruns and Marx Brothers films, his method is becomes psychoneuroimmunology, which is the relation of the brain, the immune system, and everything in the body.
Mm-hmm.
And UCLA now has the Norman Cousins Center where they study the stuff at a molecular level. And they're beginning to work with the Greater Good Center at Berkeley with how awe and gratitude, happiness, how all those things are related to molecular mechanisms in the body. So
yeah, which is all energetic.
It is, exactly.
Exactly. It's kind of hard to see, if our pets are laughing, but if they're happy and their energy is good and they get excited, they like to play, their overall beam is good, and you have some GI, a GI symptom here or there. It's like diarrhea or vomiting, but their overall beam is really good. Then it may be just a little minor indiscretion of some kind. And if two or three of those beam attributes are off, there could be some more underlying issues, chronic illness of some kind, that you would recommend going in to get some diagnostics to see if you can really try to pin down some of those issues, correct?
Well, you're asking the wrong guy. I'm an information gatherer myself. As a scientist, I want all the information to make a good decision.
Yeah.
Getting the information does not guide what you do. And that's why going to the vet for an exam and diagnostic tests and all that is always really a good thing. Even with the acute diarrhea and normal, when your kitty has, the 4P symptoms: persistent, prominent, problematic, or peculiar, something's going on no matter what the vet finds.
Mm-hmm, mm-hmm. Yeah. Do you find food? Let's go back to what you were talking about with food earlier, because do you find food, let me clarify, inappropriate food for cats causes a lot of these GI issues? Like not a raw diet, like not fresh food, like the dry food, the processed and all of that. I find that a lot in clients. If they change that, it can be life-changing for their cats.
Absolutely. Yeah. It often is. And that's actually one of the reasons why HA Holistic Actions was started. I was contacted by somebody who's, in this case, it was a dog, had chronic diarrhea in the house like several times a day and just wasn't happy. She'd been to 6 veterinarians and none recommended a raw diet.
It's really frustrating. This day and age, there's so much information out there on fresh foods and raw diets for cats. To me, it just seems like either the vets don't want to know, or they're blinders and they just like, that's not what I was taught, so I can't recommend it. Or they hear, I don't know. What are your thoughts?
That's a great point. And I'd say that eyes are opening even among veterinary scientists. Scientists always keep an open mind and look at things. But the opposite side of that coin is scientists, by virtue of the molecular focus that we've got, have a molecular focus. We look at one thing and whether it's a vet or an MD or someone in the lab, we know what we know. This holistic stuff is way too much. Way too much outside of the purview
out of the box. Yeah. I think a lot of them sometimes feel threatened because it's not what they were taught in vet school by the pet food manufacturers and their 3 hours of nutrition, so I mean, that's the facts. So I think some of them get very defensive, and some of them are very uh, um, fearful because they don't really understand, in my opinion, the biology and the short GI tract, and they don't look at the biology of cats. They look at the pet food industry and what they're putting on the shelves, and they don't really look at how cats are designed to eat biologically. And when you can honestly take a look at their biology and how they're designed in the wild, it makes perfect sense how to feed a cat. you know
And, the mother's intuition is almost always right. And if it's in accord with nature, it's
Yeah.
almost right. And species appropriate, not really something we learned in vet school.
No, and it's unfortunate because that's such a huge part of an animal's makeup.
And
Their
actually,
DNA.
we did learn it in one class in zoo medicine.
Zoo medicine, yeah, for zoo animals.
Yeah.
But there's like this truncated there's no common sense between zoo animal and house cat. It's like, but wait a minute, they're cousins. They're what, 99% biologically the same. There's a disconnect that they're not making the connection, the crossover. It's like you're dealing with the same animal here.
But you're not.
You know what I mean?
Yeah, that's actually why I adopted a Bengal. Because they're a little bit closer to the Asian leopard cat that they came from. And she is indeed, she even said we have a wild cat, like it's a mountain lion or a catamount or some big cat that comes to the house and it makes this god awful, excuse me, it's this screech, this cry.
Yeah.
My cat makes the same noise. In addition to eating anything and being very much unlike the kitties that we're used to.
Yeah.
Being picky. Cats are not really supposed to be picky.
Right.
I don't think Aviva has ever vomited. We've had her. She had diarrhea, colitis, diagnosis, colitis when we adopted her. And that went away with the raw diet that she now craves.
Yes, I agree. It's so healthy, so much better for them. Well, Dr. Jeff, this has been so fun and so informative. Is there anything else you want to share with our viewers, like maybe your Holistic Actions group and what you guys do, where people can find you? Please share.
If that's okay, sure.
Absolutely.
Holisticactions.com is the website, HOLISTICACTIONS. So it's actions. We're in the middle of 2022 is our One Health Medicine year. So the theme is, One Health Medicine. One Health is the concept that puts people on the planet can all work together in a sustainable way, and that's kind of the key is sustainability. And we're there to inform you guys, not be your veterinarians. It's really great to have an open mind to the local veterinarian. Many are, an increasing number are working with us around the world, really. And January through March is the winter bundle, which is 13 webinars, unlimited access to the forum, unlimited access to the courses like the urinary course, kidney course, all that. And one holistic medical decision-making call to figure out what to do. All that is part of the winter bundle, January to March. And that's it. And if you would like, we could maybe run some sort of contest for
whatever you. I am totally open. Sure, do whatever you. Yeah.
We can talk about that afterwards. You can put it below and.
Okay.
Awesome.
Yeah, absolutely. I just think in this day and age, we need a team. It's like there are so many people looking for a more holistic approach with their cats, but they cannot find an integrative or holistic vet in their area. And so they're having to partner with a local vet for all of their medical diagnostics, et cetera. But then they're doing telehealth medicine with somebody else, that's more integrative, that can help them look at it from a different perspective. And so, I think that's kind of probably the wave of the future, since it one person obviously isn't going to fill all of those check marks, these days. So having a team, I think it's cool, because then you can get all the different perspectives and you can just come together and go, okay, let's look at this case, this kitty or this dog, from all these different aspects, and just, it's really cool to get that collective thought. How can we team up to help this animal get well?
Exactly. And that's a direction of human medicine where you have a medical team and you need, having a veterinary team and journaling may be the most important things that you can do for your kitty.
Yeah. And keep learning. Keep learning. There's so much out there these days that's available to us. And there's studies, more and more studies coming out, that it's so cool. Finally we're starting to see more and more. So it's good. There's just so many more tools that are being developed and are available, instead of just the traditional allopathic path, a lot of people have been on. So it's great to be able to say, there is something else we can do. There's something else we can try. There's something else we can test. There's, just to have people give them a little hope and optimism, that there are answers out there. We can find them. We just have to get out of our box a little bit, and that's probably why the people that are tuning in and watching this, whether it's today or tomorrow or next week or whenever they find this, that's probably why they are doing that. They're getting out of their box because they're hungry for information. And that's why I do what I do. And I'm sure that's why you do what you do. And I love helping people find and just learn, and it's fun. Learning is fun.
It is. It's a big part of that growth mindset of you can only get better, and that is the mindset of healing for your kitty. That your kitty's body is designed to heal, and that if you collect enough info and have a good team and keep a good journal, that your kitty will get better.
I agree.
And don't give up. Where there's life, there's hope.
I agree. Well, thank you so much. Thank you guys for tuning in and watching tonight. I appreciate you guys. Hope you're having a great Friday. And Dr. Jeff and I are going to put our heads together for some sort of incentive or contest. And I'll be posting all those details on the channels. But until then, have a wonderful weekend, everyone. And we'll see you next time.
Okay. Thank you. Bye.